అనేది ఒక ఏజ్‌తో సంబంధం లేకుండా ఇప్పుడు మనం చిన్న పిల్లల్లో గూడా చూస్తూ ఉన్నాం. చాలా మందికి
Right,
పీస్ వాడే స్టేజెస్ కూడా ఉంటున్నాయి. అసలు పిల్లల్లో
right.
గూడా ఎందుకు ఇది డిసీజ్ అనేది వస్తూ ఉండిద్ది అసలు?
Very good question. Dr. Morse is asking why the young people develop hypertension.
To be honest with you, we don't really know the exact answer to that question. It is a strongly genetic condition. In other words, if a member of your family has hypertension, you are much more likely to have hypertension. But of course, as I just mentioned, many of your family members may have hypertension, but if they've never been examined, they don't have any way to know. But the genetic regulation is part of it, and that has to do with the hormones within your body. There are hormones produced mostly by your adrenal gland that regulate blood pressure. One of them is adrenaline, or epinephrine is pretty well recognized, but aldosterone is another one. And the angiotensin is probably the most powerful. So each one of our drugs targets one of those hormones that cause the hypertension. So those are the most common. We call that essential hypertension because essentially we don't really know exactly what causes it. There are some
Yes.
less frequent causes of hypertension, which are from small tumors in the adrenal gland that produce epinephrine or aldosterone, or anything that causes poor blood flow to the kidney, like a narrowing of one of the kidney arteries. But those are very rare, much less common than essential hypertension. Now, the next thing, and this is the most difficult thing, they love very, very spicy foods. And the least expensive spice of all is salt. And
Yes.
humans really like salt.
Yeah.
Humans need salt to survive. So a certain amount of salt is essential to our survival. But if you go to restaurants and you have plenty to eat and like a lot of spices, a lot of the spices you add to your food may be very high in sodium. I don't know in Hyderabad which of the foods are highest in sodium, but I'm sure that's something that the doctors who train in Hyderabad know that. Dami, what are some of the worst foods for sodium?
Well, there's a lot of food like
Biryani.
biryani is
బిర్యానీ ఈజ్ సౌత్ ఫుడ్.
very
అటువంటి
popular.
స్పెషల్ సార్ బిర్యానీ.
Yeah.
Biryani is very popular, and
మన తెలుగు వారికి కానీ, అక్కడ ఇంగ్లీష్ వారికి కానీ ఇప్పుడు పిల్స్ వాడుతూ ఉంటారు సార్. హైపర్ టెన్షన్‌కి చాలా మంది పిల్స్ వాడుతూ ఉంటారు. వాడిన వాళ్ళకి కూడా ఆ పిల్స్ వేసుకున్నాక కూడా 160 సంథింగ్ 90 అలా చూపిస్తూ ఉంటుంది. అంటే ఎన్ని డేస్‌కి డాక్టర్‌ని అప్రోచ్ అవ్వాలి? ఎందుకు ఆ పిల్స్ డాక్టర్స్ ఇచ్చినప్పుడు ఎందుకు అది వర్క్ అవ్వట్లేదు? మళ్ళీ ఎన్ని డేస్‌కి చేంజ్ చేయించుకుంటూ ఉండాలి? విజిట్ ఎలా అవ్వాలి?
ఇప్పుడు యంగ్ జనరేషన్‌లో ఇంకోటి సబ్స్టెన్స్ అబ్యూస్ తోటి కూడా హైపర్ టెన్షన్ ప్రాబ్లమ్ వస్తది. డ్రగ్స్
ఓకే.
తోటి కూడా.
హుహు.
So, and I will let Dr. Morse to answer that question. Dr. Morse is asking, like, even after taking pills, sometimes the pressure is showing 160 and not controlled. So how do you address that issue? Like, despite taking
Well,
medication?
it's very rare for a person to be on 3 medications and not be adequately controlled. I would say easily 90% of people with hypertension will be controlled with one of those with that combination. The first thing you do, go to me, is to increase the doses. If you begin the amlodipine at 5 milligrams, you may go up to 10. If you begin the hydrochlorothiazide at 12 and a half, or the chlorthalidone, you may go up to 25. The enalapril, you may start at 5 and you may get all the way up to 20. But by the time you get to full dose of those 3 drugs, 95% of the people, if they're taking their medication, will be controlled. Now, the first thing you wonder if somebody is still high after those drugs, are they taking the medicine?
Oh.
And oftentimes they won't tell you that they're not taking the medicine. They
Yes.
don't want to disappoint you, and they don't want you to think poorly of them. So you need to give them permission. I know that's hard to remember to take your medicine. Do you sometimes forget? And oftentimes the patient will, yeah, I went out of town last week and I forgot to take my medicine when I left. I went to visit my sister and I didn't take my medicine for the week. So that is one of the most common causes of poor control. But if someone still has poor control after they're on the medication, you're sure they're taking the medication, then you look for those rare causes. The tumor of the adrenal gland that can produce aldosterone or can produce epinephrine, or the tumor of or the poor blood flow to the kidney. We call that renal artery hypertension. And I think that's what Franklin Roosevelt had.
Yes.
And that can be treated at your fancy hospitals in Hyderabad with a stent.
మోర్స్ ఏం చెప్తుండంటే కొన్ని ట్రీటబుల్ కండిషన్స్ ఉన్నాయి. అవి ట్రీట్ చేయవచ్చు. ఎస్పెషల్లీ ఎండోక్రైన్ ప్రాబ్లమ్స్ ట్యూమర్ తీసేస్తే కంట్రోల్ అయిపోతది బ్లడ్ ప్రెషర్. రీనల్ ఆర్టరీ స్టెనోసిస్ ఉంటే స్టెంట్ ఏస్తే కంట్రోల్ అయిపోతది. సో డయాగ్నోసిస్ ఈజ్ వెరీ ఇంపార్టెంట్. అంటే బ్లడ్ ప్రెషర్ ఎందుకొచ్చింది అనేది ఇంపార్టెంట్. మనకు డయాగ్నోసిస్ వచ్చిందంటే ట్రీట్మెంట్ ఈజ్ ఈజీ. స్టాండర్డ్ ట్రీట్మెంట్. సో హైపర్ టెన్షన్‌లో గూడా డాక్టర్ మోర్స్ చెప్పేదేందంటే ట్రీటబుల్ కండిషన్స్ ఉన్నాయి. బట్ డయాగ్నోసిస్ ఈజ్ ఇంపార్టెంట్. సో
Yes.
డయాగ్నోసిస్ చేయాలంటే వర్కప్ చేయాలన్నట్టు. యంగ్ పీపుల్‌లల్లా ఇప్పుడు సబ్‌స్టెన్స్ అబ్యూస్ ఉన్నోళ్ళు సబ్‌స్టెన్స్ అబ్యూస్ క్విట్ చేస్తే నార్మల్ అయిపోతది బ్లడ్ ప్రెషర్. తర్వాత అట్లా ఇప్పుడు రీనల్ ఆర్టరీ స్టెనోసిస్ ఉన్నోళ్ళకి సర్జరీ చేస్తే దే విల్ డూ బెటర్. ఇంకా ఓవర్ వెయిట్ తర్వాత డయటరీ హ్యాబిట్స్ డిస్కస్డ్ కదా! అవి కరెక్షన్ చేసుకుంటే కూడా బ్లడ్ ప్రెషర్ తగ్గుతది. అది చెప్తున్నాడన్నట్టు.
But I think I disagree when you said treatment is actually very easy. Treatment is easy for the doctor. The doctor
Right.
writes the prescription,
Yes.
but for
I
the
was
system, and this requires a system to help a patient.
right,
So
right,
the
right.
patient needs to have the blood pressure examined periodically. You're running these wonderful free clinics and you
Right.
may diagnose hypertension, but who's going to check the blood pressure that patient understands why it's important to take the medication? And that involves buy-in from family members. If it's a mother, you can try to get her daughter to be a
Right.
member of the team to help. And fathers may be more difficult even than mothers, because the father
Right.
wants to be strong and there's nothing wrong with me. But the mother or his wife and his daughter need to convince him, Dad,
Right,
I
right.
know you're strong, you're our hero. However, take your medicine.
No, I was mentioning about the treatable causes you mentioned, the
Yeah.
and pheochromocytoma and renal artery stenosis. Those are the ones. But
Those can be curable, so it is
right,
worth looking for those, but they're also very, very rare.
right, right,
For every one of those you see, you'll see 100 that don't
right.
just have essential hypertension. Now, what we did in Haiti, we've got about 1,000 patients now on chronic treatment for hypertension. And in each of the rural villages, we have identified a community health worker. And this community health worker may not have any formal education, but it's a person in the village who people respect. Now in Haiti, we had the villagers choose their representative, and we pay the village community health worker a small stipend, a small amount of money. We give them a blood pressure cuff, one of the battery operated automated cuff. Patients can go to their house to have their blood pressure measured to see, is it controlled? Because again, your goal with treatment is to get that blood pressure down, certainly below 140/90, and I think best below 130/80. And you don't know whether it's controlled unless you examine it. Now, I'm very proud of Dr. Nerella and his team for their free clinics, but they may not have these free clinics any more often than 5 or 6 times a year. How many times a year, Damu?
So we did so far, in this 1 year, we did 8 health camps. So we are trying to establish, even though I am not there, I'm setting up a system where they can do every month. And
Yeah.
we are planning to go to Andhra Pradesh state next health camp, and then to Punjab and Karnataka, and slowly we want to go all over India.
What your team is going to do mostly is diagnose
Yeah, yeah.
hypertension.
So our
Treating
main goal,
hypertension
right,
is going to
our,
require a full system in the villages to sustain the program. And
yeah,
that's not easy in rural India.
right, right. So what our goal is, preventive health care. So basically, hypertension, diabetes, dyslipidemia, hypothyroidism, and for females, iron deficiency anemia. So we
Yes.
focus mainly diagnosing those conditions, and we do screening labs freely. I have a contract with diagnostics. The team comes and draw the bloods, and the results goes to the patient's cell phone and comes to my email also.
Oh,
And when there is abnormal results, then I'll call them and we initiate the treatment. And of course, for hypertension and random blood sugar more than 400, we start treatment right there. So, Harry, I think you gave a very great, explanation about the diagnosis, follow-ups and compliance and treatment. So, can you tell the audience about, the complications if untreated?
Yeah, I think it's important to remember blood pressure is not a bad thing. Blood pressure is essential for our survival. If your blood pressure is too low, you will die. So, blood pressure is carefully regulated in your body in a range that provides the best blood flow to all of your vital organs. And the key vital organs that we talk about mostly for arterial blood pressure are the brain, the heart, and the heart, though it's full of blood, the heart counts on 2 little arteries, the coronary arteries, to give the blood supply to the muscle itself. And the muscle does a lot of work 24/7, 365 to keep the blood circulating in the system. So when God designed this system, it was intended that the blood pressure be in a very carefully regulated range. You need a little higher blood pressure when you're working. And if you're a laborer in the fields and plowing and digging and doing heavy labor, you need a little bit better blood pressure to do that work. So blood pressure itself is not a problem, but blood pressure that is chronically elevated above what is normal. And as I mentioned, normal is somewhere between 100/60 and 140/90. it should rarely go out of that range, but people with hypertension are above that range almost all the time. Even when they're sleeping at night, they're above that range. So that is what is damaging. And it makes sense that the tissues at the end of the line that are getting the blood flow suffer when they're chronically under high pressure. And that high pressure is damaging to the tissues of your body. So that's your brain. The brain and the heart are probably our two most vital organs. Without our brain regulates so much of our physiology downstream. It was regulated by the brain and by the pituitary gland. And then the heart, of course, is the main organ that circulates and pumps the blood to every tissue of your body. So when those two organs are damaged by the high pressure, that's what leads to the stroke. That can lead to a hemorrhage, and that's when a blood vessel in the brain actually bursts and it causes bleeding into the brain, and that is a catastrophic event. It oftentimes leads to death, and sometimes worse than death, it can lead to a lifelong severe disability. And that can be an inability to speak, an inability to walk or talk, weakness on one side of your body or the other, seizures, lots of things can be consequences of a stroke. So preventing a stroke is important. Heart attacks can be fatal initially. Heart attacks, if you survive them, there's a little damage to the heart muscle. Then you have another little heart attack, and each time your heart gets a little bit weaker. And if you survive all those heart attacks, then you have heart failure because the pump itself is not strong enough to do the job that it needs to do 24 hours a day, 7 days a week, 365 days a year. Your heart never has a day off, and neither does your brain. So those are the main organs. Now the third organ system that I'll mention is the kidneys, and the kidneys likewise receive blood flow from two arteries, the renal arteries that go to the kidneys. And if your kidney is being hammered every day by high pressure, that can be damaging to the kidney and to the kidney's function. Your kidney is very important to the regulation of all of the chemicals in your blood. The kidney filters out toxins that have to be removed from your body, and it also takes some sodium out and puts the sodium back in. It regulates the level of sodium in your blood and the potassium in your blood and the bicarbonate, the acid base of your blood, very carefully. All that's regulated by the kidney. So if the kidney is damaged with high blood pressure, it also can be catastrophic and ultimately fatal. Kidney failure will eventually kill you. Even if you get dialysis, dialysis may prolong your life for a while, but it's not as good as having your kidney the way God made your kidney. So you're much better off, again, diagnosing the hypertension, treating the hypertension, protecting your brain, protecting your heart, protecting your kidneys. And that's our job as doctors, as healthcare professionals. Our job is to protect our patients from the consequences of disease. And again, this is called the silent killer because you don't know you've got it unless somebody checks your blood pressure. So go to me. I will ask you a personal question. When was the last time you had your blood pressure checked?
గౌతమ్ ఎప్పుడు బ్లడ్ ప్రెషర్ ఎప్పుడు చెక్ చేసుకున్నాను లాస్ట్ టైం?
నేనా సార్ రీసెంట్గానే సార్ బ్లడ్ టెస్ట్లకి వెళ్ళాను ఒక 1 వీక్ బ్యాక్.
So she got
We
it
must,
tested recently.
Okay.
anyway,
BP
but
normal
most people,
Normal, sir, normal.
normal.
Yeah.
most people don't really ever get it tested unless they go to a doctor.
Yeah.
And most people don't want to go to a doctor unless they're sick.
Yes.
So they wait until they're sick, and when you're sick is not the best time to measure your blood pressure, because it may be a
Yeah.
little higher when you're sick or a little lower. But the best time to measure your blood pressure is at a free clinic with Dr. Nerella's organization, and a clinic that goes to your village, and you set up where in a place where people are comfortable, and you check their blood pressure. And it doesn't have to be
Yeah.
a doctor that checks your blood pressure. It can be a community health worker. It can be anyone who can make help the patient relax, put the blood pressure cuff on, punch the button, and you get a digital readout of the blood pressure. And if it's very high, that patient needs to be flagged so they go to see the doctor.